Derby Health and Wellbeing Board. I'm Councillor Alison Martin. I'm the new Cabinet Member for Health and Adult Care in the City. So I'm currently chairing this particular board as well as being the co-chair of the Integrated Care Partnership. In a moment, I think we might just quickly go around and introduce each other, if that's all right. But before we do, I'll just see if there are any apologies.
Hi, yes, I've had apologies from Councillor Lonsdale, Amjad Ashraf, Emma Aldred, Robin Dewis, Michael Kay, Claire Mabrani and Stephen Posey.
Okay, thank you, Lindsay. Right, before I just move on to the business then, I think I think a lot of us know each other, but I think there are still some faces that I don't know. And I can't see everybody's name badge. So if we just very quickly go round and say who we are and which organisation we come from, please.
Hi there, I'm Gabriel Milnes, Director for Commissioning, Derby City Council.
Thank you, Chair. My name is Pervez Sadiq and I'm the Director of Adult Social Care Services for Derby City Council.
Hi, Chair. Ian Fulliger, Head of Strategic Housing at the Council.
Sue Cowlishaw, Chair of Derby Health Watch.
I'm Lucy Kerr, I'm one of the councillors.
Good afternoon, colleagues. Chris Clayton, Chief Exec of NHS Derby in Derbyshire. Thank you.
Good afternoon, Margaret Gilday, Non-Exec for the ICB Derby in Derbyshire. First meeting.
Good afternoon, everybody. I'm Richard Wright. I'm the Interim Chair for the Integrated Care Board.
Good afternoon, I'm Carmel Ashby, local councillor and just retired from the NHS yesterday as an advanced nurse practitioner.
Congratulations, Carmel, and thank you for all your years of service to the NHS. Thank you.
Hi everybody, I'm Rachel North, Deputy Executive of Derby City Council.
Hi, Owen Swift, the Physical Activity and Sport Strategic Manager at Derby City Council.
Hello everybody, Denise Baker, Derby University.
Good afternoon all, Gino Di Stefano, Director of Strategy at UHDB, here on behalf of Stephen Posey.
Right, thank you everyone, thank you for that. We don't have any late items. Do we have any declarations of interest? No, thank you. You've all received a copy of the minutes of the last meeting on the 16th of March this year. Are we all happy that they're an accurate record of the meeting and happy to note and accept the minutes? Yes, I take silence as acceptance. Right, thank you very much. So on the agenda, the item 5, we have Andy Smith is going to be joining us in about an hour. So we're going to take as the first item today, the update on Move More Derby, physical activity plan for Derby from Stuart Batchelor and Owen Smith. Thank you.
Great. Thank you very much, Chair. Now I know how to turn the intercom on. Sorry, I didn't realise it wasn't on a moment ago. So I'm Stuart Batchelor. So I work for Active Partners Trust, which is a charity that covers Nottinghamshire and Derbyshire, but I head up the Active Derbyshire part of that organisation, and I specifically work in Derby alongside Owen around the Move More Derby strategy. So in a moment, Owen's just going to go through a bit more detail on the review that we've conducted, and then hopefully we're going to bring it to life in terms of the work with a couple of videos and just some stories of the good practice that I have to say is getting national recognition, because some of this work in Derby is leading across the country in terms of how you can take place-based work and apply it in a physical activity and a health and equality setting. So over to Owen.
Thank you, Stuart. The previous iteration of Move More Derby with the physical activity and sport strategy for Derby City was from 2018 to 2023. Previous Health and Wellbeing Board in November, we presented a proposed approach of how we were looking to refresh that strategy. So working with partners in the city and our public health colleagues, we've looked to focus the review and the refresh around Move More Derby, and looked at the governance structure and arrangements for where that could best be placed and best sit and fit. The previous strategy was owned and adopted by what was the Culture and Leisure Board under our previous partnership arrangement. Moving forward, what we'd like to do with Move More Derby is develop a delivery plan, and a delivery plan that specifically is developed and is developed to deliver against the priority outcome of increasing participation in physical activity, which is one of the priority population health and equality indicators adopted through for the Health and Wellbeing Strategy and Joined Up Care Derbyshire. So our future governance arrangements, we are recommending that the Move More Derby is a delivery plan, and that then sits under the Health and Wellbeing Strategy for the city as a direct delivery plan to deliver against that outcome. We have a Move More Derby leadership group made up of partners in the city who will meet 3 to 4 times a year, who will set the direction around that work, to check and challenge the work that is happening within the city, but also more than anything to look up and look ahead, to identify where some of the levers are for change, to create change within the physical activity system. And then underneath that we have connections and alignment to lots and lots of networks and forums across the city. One of the successes of the existing Move More Derby work and strategy was the purposeful network building that's gone on to actually ensure that physical activity is represented and supports wider, broader outcomes for the city, just as much as it does for increasing levels of physical activity, but recognising it has a really important part to play for our individuals and our communities across the city. As mentioned, we are aiming for the plan to be a direct delivery plan for the health and wellbeing strategy for the city, but it will also link to a number of strategic documents that we already have in place, such as our local plan, leisure facility strategy, playing pitch strategy, our county-wide plan of making a move, and our children's healthy weight plan. We're proposing that the draft structure for the physical activity plan is shaped really on 5 main key themes, those of communities, environments, people, sport and leisure, and partnerships. Underpinning that, the themes and the ways of working, we will be really articulating the ways of working, building on the experience and the learnings that we've taken from Move More Derby today, especially in terms of how we work at place level. So adopting that whole systems approach, which we have done from 2018 through the work, the learnings that have come out of that, and then building upon that with the principles and the values that we've identified and created that need to be there in place to create that change. Underpinning all of the work and the key themes for the physical activity plan is around learning. Over the last 5 years, we've done a lot of learning around Move More Derby, and especially around the implementation and adoption of a whole systems approach and what that looks like for our people and within our communities. And really aligning that to the place-based working within our localities, within the city, to really have a steadfast focus on identifying where we do have inequalities and how we work collectively and collaboratively at place level and city level to really look at supporting our communities and reducing those levels of inequality. So what I'm just about to do now is just go through some of those themes in more detail, and on some of those themes, as Stuart mentioned, we've got a couple of videos that will just start to bring some of that to life in terms of existing work that has already happened. Environments we know are critical to support not just people to being able to be physically active, but healthy behaviours. When we talk about the environments, they play a really, really important role. Yes, for people to be physically active, but just as much as we are here from the lens of physical activity today, they play just as much an important role within how we look at obesogenic environments, how we reduce levels of obesity, how we support people with their mental health. So environments is critical, and how we create and maintain and develop safe, accessible places and spaces for people to be active, have wider health behaviour outcomes.
Thanks, Owen. And just an example of that, there's just recently some research done around parks, and particularly girls, and 49% of girls don't feel safe in parks. 80% of parks professionals think their parks are safe. So there's a real disparity there, that our parks are very much acceptable and great for young men to use, but actually girls prefer to go to the houses of their friends. So we're missing potentially a generation of young people, girls particularly, accessing our parks. And that's really relevant because we're hoping that there's going to be significant investment across Derby's parks and open space in something called Play Zone, which is money coming through Football Foundation. And there's a number of sites that we've identified to go forward as part of that. But we've really got to make sure that this investment doesn't only cater for young men, and that girls and women don't feel part of it. And it might not be that they want to use the actual play zone, which is essentially a caged kind of sport area, but how do we set that into the park as a hub for which there are meeting places and other activities that girls can do and other people who live around the parks can also use. So we need to try and have a discussion in Derby and in Derbyshire, because there's also going to be more investment from Sport England into parks, about how we make sure that that investment is landed in a way that means everybody can be included as part of that. And we're starting that with we call a talking space. So it's a virtual discussion session. And I know the Police and Crime Commissioner for Derbyshire is quite interested in that agenda, because that week there's a conference around serious violent crime and women and girls. So it's very much bringing the agenda of community safety and people feeling safe in their environment together with making sure that the investment is done in the right way.
Miss was a really close friend of mine, so Evergreen is something that I've been part of for such a long time. And hiking is something that I do in my private time. So when Miss Ba mentioned they've got this group together, I was like, yeah, definitely want to be part of this and do as many of the walks we can. A few friends that live close by, we would just text each other for like a late night walk, and then from that we realised that actually we're really enjoying this, and it helps us unwind, and it helps us just clear the cobwebs of a rough day at work. And then when I would see posts about hiking, like charity events going on, it was my way of just giving back and getting involved and raising a bit of money as well. And then when you are with your friends or with anybody that you walk in, it gives you a great opportunity to talk and have those like sort of chilled out conversations that maybe there might be something on your mind and you want to just confide in somebody, but on a normal day you wouldn't, because you would just think, oh no, I'll leave it, I'll block it out. But by going out and just unwinding and allowing the surroundings make you feel relaxed helps you open up more. And then when you've got home and you think, oh yeah, I'm glad I had that chat. And it just helped me with my mental health a lot. And that really encouraged me to get out more and connect with what's out here. I love it. It's an amazing feeling. You get this feeling of, I've achieved something, I've done something. You know, I've been active and wasn't able to get to the gym, but motivating yourself in the morning to do the walk can be a bit tricky as well. But once you're out there and you've done it, you come home, it's a really good feeling, yeah.
6 months ago, I was morbidly obese.
Audience, so we've engaged with a marginalised priority audience to really think about how do people feel safe within their environment. And that was just an example of some of that. We're working with a specific cohort of our community to support them to access nature really in terms of an environment that they've not previously done so. And communities, I suppose, is the next theme. And communities are really, really important, and we've learnt a lot through the last 5 years through the work around Move More Derby, and specifically around our approach to place-based working, and thinking about how do we start to create change within places, the approaches that we need to do that, identifying what the system is at play within localities for certain priority audience and marginalised communities for them to be active. And there's an example of some images there just on the right-hand side of the screen. And this is a piece of work that is focused around the DE23 area. So in Derby City, that's Arboretum, Normanton and a bit of Abbey. And that's looking at how do we use investment from the Football Foundation, which is basically football investment. How do we use that to create change within locality and sustain change as well? So it's not about putting football on. It's around how do we understand our communities and for the investment to be influenced by that community in terms of what it is that they want to do. What are their aspirations? What are their barriers, their challenges or enablers for them to be healthy as well as active? And so the focus of this work is really trying to understand from some of our more marginalised population groups within that area what that change could be and what role can they play within that, and actually how do partners come together to support that change. So there's a real diverse mix of partners from the council through to traditional football organisations who are now collaborating and working alongside our community to support them to be active. And we're seeing some big impacts there. We're seeing a community that has got no association with football, for example, going to Derby County games. They are now coming together, utilising some of the assets within their communities for lots and lots of different reasons and purposes. And a knock-on consequence of that is they are now starting to be active in those places as well. So working alongside those communities, creating that safe environment for them to be able to connect and support each other is now having the knock-on effect of them being able to be physically active.
Yeah, just very quickly, I think this is an example of where Derby is challenging the rest of the country and the approach. Because as Owen said, this was Football Foundation money. The approach from Derby was that a community action Derby, with the accountable body, led it. The only non-football association in the 43 projects that exists, and also that football didn't figure in the first year or 2 years of the programme. So that really challenged Football Foundation and Sport England to think differently. If they wanted to invest in getting communities active, it wasn't going to be through football necessarily. So it's very much Derby's being looked on in terms of how this works.
Inequalities is key to the work and around Move More Derby, focusing on reducing levels of inequality. And we know that some audiences, some population groups and priority audiences are further away from physical activity than others, and they face more multiple compounded challenges or barriers. So we have a focus within the plan around certain population groups and priority audiences of older people with a disability alongside health condition, women and girls and lower socioeconomic groups, and children and young people. And within all of those population groups, we will have a focus and specific intervention and support for those levels, for those population groups. And we've got another example of actually what some of that looks like in practice in terms of working with some of our communities. Again, I think the key thing here is we are working with them. We are not there as a group of partners delivering activity. We are there to support that in our existing networks, to build on the strengths that are already there, to really think about actually how can we support them, and some of that might be through elements of funding or support to support their individuals to be active.
We do so much things, gardening, the drama, but we also go on outing, we do craft, we learn to sew, we do the cooking. We've been running the warm-up now for nearly 3 months, feeding the community. Our adults are really growing in confidence. They're talking to members of the public and they're learning about things that are going on in their community that maybe they wouldn't have been talked about because, you know, they are very much kept sheltered, you know, from all what's going on in the world. And we think it's really important that actually they are part of this because it is their community. And for us, it's really important to have these adults on stage because when I started many years ago, I was doing amateur dramatic and there was no disabled people on stage. When I worked with disabled adults and was asking them, you know, what about drama? The answers were, well, you know, they said they don't need anybody, or if they did, they would end up at the back of the stage and not giving the opportunity to shine. And so when I set up the drama group, to me, it was important to do shows, real shows, and to run the group as a proper amateur dramatic. And so that's what we do. Things are changing. Last week I was in Nottingham, I saw a play called The Village Idiot. There was 2 adults with learning disability who had main parts, and I think that's the start of really seeing these people on stage shine, because they are able. They are really, really able. They're very creative people. So, so yeah, given the chance, hopefully, our adults, who knows, you know, one of them might end up on the stage at Derby Playhouse, or, you know, in a few years' time, who knows. But yeah, the whole experience of opening our own place has been amazing, and we're just hoping to stay here and grow within this building and achieve many brilliant things, more projects. Weight is a big issue among adults with learning disability, so it's really important for us to address the issues for your health, you know, to try to be careful what you're eating, to cut down on certain food, but also to obviously bring in exercise into it. So yes, we've got the dance, we've got karate, we go on walks, we even do like a meditation now. It gets them to look at inside of them and how they're feeling inside. And we know that some of them, you know, have said, I don't feel healthy. You know, I can't go up the stairs. When I go up the stairs, you know, I can't breathe. What's going on with me? And so it's addressing all these issues that, again, maybe at home they don't talk about. So yeah, it's really important that we do exercises, and so every day really. We're always on the go anyway, so we're always moving about. We've got a room downstairs, and we spend very little time in that room sitting down, to be honest. So yeah, and even the drama group, you know, brings in again the dancing and the interacting. So yeah, a lot of movement going on, really.
Our next theme is sport and leisure. And sport and leisure plays a really, really important role. We have some high quality facilities in the city, both currently open and still in development. There's a couple of examples there. The top one would be Morley Sports Village. And then we've got the Derby Racecourse Hub, which is due to open in early 2024 in Derwent at the racecourse. Key to support some of the development of these facilities and embedding them within the communities where they are is the place-based work that we've done. So what we did was we embedded place-based working to understand the places where these facilities were going to be. So actually, in terms of supporting the activation then and the use of these facilities, especially by those who maybe have the least resources or more marginalised communities in terms of our priority audiences, really allowing them to help come in and support and shape both the facilities, but also the programming and the opportunities that are there for them, so people see it as something for them. The racecourse is a really good example of that with the racecourse hub. People that live in Derwent and overlook that green space, they see it as for dog walkers and for footballers. But this is a fantastic green space that could be a really great community asset for a whole range of delivering against different outcomes, physical activity as well as other health behaviours. What we want to do is use investment, again, from the Football Foundation, which is predominantly orientated at football, to regenerate this area of the city. To regenerate this area and transform it from a space that's seen solely for footballers and dog walkers into a community asset and a community space where people see it as for them. So sport and leisure is really key, and that reflects in terms of where we are able to work with our partners at a national level to secure investment and resources to come into the city to help us deliver against our outcomes. And then finally, partnerships. People and partnerships are key to everything that happens with regards to Move More Derby and the work that happens. And we'll be working even closer and more collaboratively across organisations and community boundaries to ensure that physical activity plays a central role to support and to deliver against the outcomes of the health and wellbeing strategy. And we want to have a real good focus around health and social care. In our last iteration of Move More Derby, that's probably one area we weren't as impactful as we would like to be. So we are seeking to try and look at actually where do we have more of a greater focus to work collaboratively alongside our partners in health and social care and the community to really think about the role that physical activity can play and how do we embed that within them.
Yeah, and this clip that follows up is a partnership between Everyone Active who run Morway Sports Village, Lister House Surgery and Move More. And it was around living with pain courses, how they finished their course they still want to be supported. How do we transition them into a new setting where they can be active? So Everyone Active at Moorways now offer a hub session once a month for people who've got long-term conditions, and actually we've included people with pre-obesity diagnosis into this session. So they go together and have a cup of tea, spend time in the cafe. But then there's the opportunity for them to have a personalised activity identified for them, which it might be using the gym, it might be swimming, but it might also be walking, it might be gardening. So they're supported into that new environment, and the response we're getting is really great in terms of people coming along to that and wanting to grow and wanting to bring people who haven't been on the Living with Pain course. But the leisure centre is becoming a real hub for that community and providing that space. They're still getting some income because people may well join the gym or swim later on, but essentially they come to that space. At the moment, with some Sport England funding, the Everyone Active are getting some funding to put people through a 12-week programme of activity. But we're hoping this becomes sustainable and doesn't need that external funding. But it's a real example of where the health side, in terms of the surgery, is working together with a community provider to move patients into that new setting. And then hopefully we will get a reduction in the number of GP visits, potentially a reduction in the use of opiates, because people are managing the pain themselves. We probably won't show you want to show the video, see if because you might be able to hear it. But the key to this partnership working is the individuals. So the person there is Lauren Slater, who is from Derby, worked for Derby Community Football Community Trust, is a young mother, didn't really engage a lot in school, but saw sport as a way to be active. And she is absolutely leading this work and linking people together. And her, along with someone called Dawn Lee, who was one of the health and wellbeing coaches at Lister House. She works for the Live Well scheme. Her incredible energy and enthusiasm to bring people together is actually what has made this work. So if you get the agencies willing to work together, and then you develop those local system leaders, as we call them, then you've got a real opportunity to make a difference.
Excellent, thank you very much. I mean, oh, sorry, you can't hear me now. Did you hear me at all there, Carmel? Okay, I'm just saying that thank you very much for that. That was excellent. And I'd be very happy for you to bring the videos back to another update, because I think they looked really fascinating. I just couldn't hear them, and I probably have worse hearing than most people in the room, that probably means, but which wouldn't surprise me.
Chair, I've been checking the broadcast and you can see them on the broadcast, so you'll be able to watch them then.
I think it's the audibility that's the problem.
You can see them on the broadcast and hear them properly.
Oh, can you? Okay, thanks. Well, anyway, they are excellent. So, I mean, I'd still be happy to come back maybe another time, perhaps if it's part of a further presentation, because I'm sure you will be updating us. But thank you, Lindsay. So anybody who couldn't hear it, you can watch it on the broadcast on the Derby City Council YouTube channel. Under live is the key icon to push. Thank you. So do we have any questions for Owen and Stuart? So I'll take Chris Clayton first of all, please. No, Chris Clayton, you're Richard Wright. Apologies.
Thank you, Alison, Chair. It's a great programme, okay, and I'll express an interest because until last year I was on the board of an Olympic legacy project called the National Centre for Sport and Exercise Medicine. You're nodding your heads, you know it. I was involved in the Sheffield one, and I just want to go into the partnership bit a little bit in a minute, but it's obviously a prevention project, this. You know, it extends healthy life expectancy, activity, and it's all ages. You mentioned that. Start young, it's even better, but even for people much older, it gives real benefits. We found park runs were really good as well, by the way, in Sheffield. Just they really engage people across the patch. But what I wanted to say was that the difference between, it was called Move More in Sheffield as well. It's like a deja vu, this. It's just exactly the same. But the one thing that was different in Sheffield was we co-located doctors' surgeries into the centre of activity centres. So when people came to see the doctor, it wasn't always about prescribing drugs. We sent them down the corridor to the National Centre, the Move More Centre, where there were exercise experts, nutritionists, mental health, and tried to engage people as an alternative to the medicine. It worked massively. You mentioned it there, the biggest beneficiary was mental health. The second was cardiovascular, particularly on insulin prescriptions. It reduced insulin prescription, and insulin's really expensive, by the way. And the third one was musculoskeletal. So this does really work, and it is. We did it all in the poor side of Sheffield, not in the rich west side. We did it in the more difficult end of Sheffield, and that's why the park runs were so successful. But it's a brilliant programme, and it does work. And well done for getting football money in, because Sheffield and Derby have been a bit football poor over the last few years at top level, haven't we? So you've done really well to get the football money in, that's what I would say, anyway. But it's a great programme, and that's where the partnership between the National Health Service and the local authorities in this, and where things like One Public Estate can actually really come to the forefront and make a real difference to people every day. So I think it's something that we should look at more going forward. I think it's a really good programme.
Okay, thank you, Richard. I think what we'll do is, before you respond to that, I think we'll see if there are any more comments, and then you could respond to that. So it's a thumbs up from Richard. Any other comments on this? Sue?
Just wanted to know if you've involved private providers, because you've alluded to the racecourse scheme and more ways, but what about the private sector?
Yeah, so voluntary and private sector. I briefly mentioned that we spent a lot of time over the last 5 years in the previous iteration of Move More Derby of purposeful network building to try and create networks that connect up capacity and capability. And we have a really thriving network of over 120 organisations and individuals called the Move More Derby Network. And on there we have everything from public, private to voluntary sector leisure sport providers, organisations who are part of that conversation, that journey to try and connect up what assets we've got. So I think that that example there around the One Public Estate and what they've done in Sheffield, we don't necessarily have that at this moment in time in Derby. But what we do know is that those assets exist. So part of our ways of working with Move More Derby is to create the space where that and facilitate the space where that collaboration can take place. So trying to connect those elements or those factors or those partners where that collaboration can take place. And I think, back to Stuart's point, that example around the Lister House one is an example of that. Actually, our role within that, in terms of mine and Stuart's directly, was bringing together people to start to build relationships and have connectivity within place. So actually we might not have a physical GP surgery in a leisure facility, but we do have a GP surgery and leisure facility that work together in collaboration, just as much as we do with some of the private sector organisations as well. That might be part of our Move More Derby network.
Okay, thank you.
Yeah, just picking up the Lister House, there's a programme called Active Practices, which is normally associated with GP surgeries practices in the southeast in nice leafy suburbs, but we're hoping that Lister House may well be one of the first in Derby, to take this framework on. And it's about both the staff within the practice, but also their patients, everything thinking around activity and how you can promote it a lot more. So that's kind of trying to pull together a bit of where the thinking around physical activity in a setting. But also, it's great that you mentioned park runs, because both park runs and leisure centres traditionally, in most places, are there for people who are relatively affluent and already relatively active. What we're trying to do is change how, more ways of doing this, they're actually attracting different people who aren't active, who don't normally come to leisure centres. So they're becoming health and wellbeing hubs rather than sports centres. And the same with Park Run. If we can get people to be, I mean, some of the work that we do, most of the work is actually getting people before they're ready to run. So how do we get them out and they feel safe in the community? But absolutely a really important part of the system, and you know, is run by volunteers. So it's perfect.
Okay, thank you. So I've got Denise, and is it Gino? And Denise and Gino then, thank you.
Thank you, Chair. I'm just wondering if you're linked to the university at all in terms of research and evaluation, but also our students and our staff being involved in either sport or health and wellbeing or the community projects as well.
You and Gino?
So certainly echo the comments made about how great it is to hear about this sort of programme as part of our wider work on improving population health. There's been a lot of reference to primary care as a key access point really for people, and I just wondered about how we might broaden awareness and allow other stakeholders to signpost people that might benefit. It struck me recently how much we have between partners across the city that not every partner is aware of. In an example, there's this recent place board of a practice talking about a big voluntary sector player 3 doors down with lots of value, but they weren't really aware of each other. So I just wondered about your thoughts on raising awareness more broadly across partners and how we might make sure we can all signpost people that might benefit. Thank you.
Shall I do the university one first? Yeah. Okay, but in terms of the university, yes, simple answer. University have been were integral to the intersection of Move More Derby, so working with Dr. Chris Bussell, and then we've got Professor Andy Pringle involved, who supports the Move More Derby leadership work as well. In terms of how we can start to get partners connecting up, that's exactly what our place focus is. So the role that we try and play within place is thinking about who are some of those system actors at place there and connecting up those partners and creating that collaborative space for actually that to happen. So to really think about what are some of the assets within communities and how do we link those to some of our priority audiences. So we have dedicated resource from partners that partners have invested in who play that role at a locality level, and then we're also working with our other colleagues as well around our locality approach and how we start to basically make sure there's better and more purposeful collaboration at a local level to enable exactly that to happen. So actually we know our neighbours, we know what they do, and we have a relationship there. And it's not transactional, it's a working relationship.
Okay, thank you. And finally, Carmel, I'm gonna have to. There are lots, so I'm very mindful of time. So if you could ask the questions very succinctly, and I'm going to ask Owen or Stuart to answer very succinctly too, please, because it's great that everybody's interested, but we are pushing on time here. So Carmel and Rachel.
Thank you. That was excellent. Just a quick question. With the work that you're doing to looking at girls and getting other people more active and the younger generation, are you looking at doing anything for children with disabilities, getting them more active? Because obviously we saw what happens with the adults with disabilities and the, lot of obesity, etc. That was just...
Thank you, Rachel.
I haven't got a question really, but I want to say one quick thing really. I probably should have declared an interest at the beginning that I am actually a member of Active Derbyshire board. I even got my badge on, Stuart. Who'd have thought that? But anyway, they've both underplayed some of the work they've done to get to this point. I wanted to make that point for everybody, really, in that to work differently, to not think about top-down solutions from agencies to try and solve complicated problems, but to work with communities in an integrated way is quite radical, obvious, but radical. And the work we've been doing across the organisation and the city in creating a partnership board and a partnership culture of how we share information between different parts of the public, private, voluntary sectors to try and tackle complicated issues is an ethos we have in the organisation and in the broader partnership. I would say that the health service and the health system needs to be more integrated into that way of working. We are slightly missing a trick, I think, with some of this work, and we can do a lot more with it. But I think it's a fantastic example of that we can hopefully build on. Thank you.
Thank you. Do you want to answer quickly then, if you don't mind?
Yeah, absolutely. A priority group for us, young people who are disabled, and we've helped secure Department of Education money to called Opening School Facilities to work with special schools in the city, which is out of hours activity, and included actually paying for transport to take them to venues. So that absolutely works. And in the community, again, working with groups and individuals, both workforce development, but also identifying funding and supporting groups deliver activities. So
thank you, thank you. So it was Margaret, and was there someone else? There's the last question, I think, because I also have Margaret and Lucy, and be a quick one then, Lucy, please. Thanks.
Thank you. It was just relating, following on from Gino's observation. When we discharge people from acute hospitals, are they signposted to the activities?
Lucy?
And it's really following on the theme of knowledge, and the knowledge needs to be there, obviously, within the potential organisations that want to be part of the network, but also to people who potentially want to get involved. And I think there's a lot of work that could be done on that communication. And I'm just wondering whether it's something that the network could in some way lead on, because the private sector elements of that network, it's part of their advertising as a private sector entity. And I think they might come forward with some advertising funding to help with that.
Thanks, Lucy. So very quick, those two comments, if you can, please.
yes, I'm not aware that there is a link at the moment in terms of discharge patients into opportunities, and it's certainly where the system needs to be joined up. Just picking up about the networking opportunities, there is something called open data, which Sport England are trying to push, in which all providers, whether public, private, voluntary sector providers, open up their data so that, for example, a social prescriber can just go onto the system and identify opportunities for people to be active, to do gardening, to do other things, and which the private sector will be part of. So that's something we're trying to almost pilot in Derby and link with, I think the social prescribers have got a system called Joy at the moment, and it's how, if they open their data for it, it would really be a bit like Airbnb or something, or where you can actually very easily find an opportunity in your area that's right for you. But linking together is absolutely crucial, and what we do all the time.
So, thank you very much. I have a couple of quick points then. The kind of, just for the sake of the document itself, the recommendations are 2.1 to proceed with the preferred option of the government arrangements for the Move More Derby delivery plan. But that preferred option is not articulated at all in the document. So we need to make an amendment to the document to do that, so that you can then report to the Health and Wellbeing Board, which from the response in the room, I'm assuming that everybody is happy with that recommendation. Yes, so that's the first one, thank you. Just on the recommendations, before I come quickly onto my points, I suppose, therefore, we are all, from the responses in the room, it's very positive. We do approve the proposed priority themes that they've just articulated. Is that correct? Everybody happy with that? Yeah, okay, thank you. So just a couple of comments, really. I think, obviously, Owen, you know that I have had some experience with some of the work you're doing recently as a local councillor. So I totally understand. I mean, football and cricket as the areas of activity, they're going to have a very important but limited audience. So I totally respect and agree with what you're doing from the health perspective, which is where we are now. And we no longer have a culture and leisure board, I think, in the council. So it's absolutely brilliant, and we all in this room will support that. Just a point, though, that I think it is important in relation to the experience we've recently had in Darley, sorry to be parochial here, but that we actually carry the established sporting organisations with us, because when we renovate an area and set it up for a certain kind of sporting activity, when that activity isn't happening or doesn't appear to be likely to happen, this is causing other tensions. Now, I very much support what you're trying to do, but I think we mustn't lose sight of that, the importance of engaging properly with those organisations too, just to so that we don't have tensions around them. And just a quick point on the racecourse and in general in Derby, dog walking is a really, really important way of people keeping fit of all ages, and I would say girls also especially. So I think that whilst I appreciate what you're saying about the racecourse, I mean, the last time I was over there, it's just this big, massive green football and then dog walking. But those, I suppose what I'm saying is don't throw the baby out with the bathwater. Football's really important for boys and increasingly girls to keep fit, but it is limited. I've never played football. I never would, particularly because I'm not interested in football particularly. But then the dog walkers as well need their space, and I shouldn't be pushed off. That would be my opinion. So if you could agree to amend the documents, and I'm quite happy if you don't. Do you want to come back on the comments I've made, or just happy to nod your head?
No, I can. I think especially with the dog walking, yeah, absolutely, and the clubs, yeah, sport plays a really important role. It's a really important role, valuable in society. So that's all sports as well. And lots of the sporting clubs and national governing bodies within the city are engaged within the Move More Derby work. And you're right, you're out dog walking, yeah. In terms of that's part of the offer, and making sure that the space is there. And I think that's the ethos of Move More Derby. We want people to achieve minimum recommendations set by the Chief Medical Officer for physical activity. But ultimately, if you're already doing something, we want you to do more. So if you're dog walking, what more could you do? If you're not doing anything, could you do something? Yeah. So that's yeah.
Okay, thank you. Well, I think you've had some very positive feedback. I think there have been some really interesting suggestions too. I mean, many interesting suggestions, but I don't know if there's a way of coming back on this issue of the hospital discharge and the connection there. I thought that was a really good suggestion. Is there something partners here can do to take that away, to look at?
Chair, we'll take that away and we'll look at providing information to the discharge teams at the hospital about how they can connect into the programme.
Thank you very much. Thank you. Well, thank you both. Right.
Thank you very much.
Right, so now I see that Andy Smith has just arrived. So hello, Andy. Thank you. So we'd held up your item until you arrived. So are you ready to deliver for us the update on the Derby and Derbyshire Integrated Care Strategy? Thank you.
Thanks, Chair. So the purpose of this paper is to provide an update on progress on the Integrated Care Strategy. Just as a bit of background, Integrated Care Partnerships are joint committees between the NHS, ICB and upper tier local authorities, bringing together an alliance of partners to facilitate joint action to improve health and care outcomes for the whole population. And the main function of the Integrated Care Partnership, the ICP, is to develop an integrated care strategy. And the broad purpose of the ICP strategy is how we all work together to improve the health of Derby citizens and make the transformational changes we need to make to tackle system-level health and care challenges. So we're talking about Derby today, but the strategy is a Derby and Derbyshire-wide strategy. So we've considered the ICP strategy at an earlier meeting of this board, and it was approved for publication in June, and it's been through to the Derby Cabinet as well for sign-off. The key areas of focus in the strategy are outlined in section 4.5 of the report, and there are three areas: start well, stay well, and age well and die well. Back in June, towards the end of June, the VCSE sector organised and led a partnership event launching a memorandum of understanding which provided the opportunity for over 200 attendees to come together to reflect on the strategy and to feed in their suggestions and perspectives on the three strategic aims. And we're currently working through the array of different feedback that we received at that event. It's really important that the strategy builds on what we are already doing well as a system and doesn't duplicate, which means that where possible we're looking at existing partnership groups to lead each of the three strands, each of the three areas. And there's work at the moment on how there's essentially going to be a route map or a road map for how we try and address each of the three strategic objectives, also looking at pragmatic things around capacity and the way in which we need to try and move forward and deliver against the 3 strategic aims. So there are a range of requirements outlined in, I think it's paragraph 4.9 to 4.12 of the report. I'm not going to read them out. Hopefully colleagues have had a chance to read them. I think overall there's a real focus on prevention. There's a real focus on reducing health inequalities and healthy life expectancy, which very much underpin the aims of the Integrated Care Partnership and are mirrored across, I think, our organisational strategies and what we're trying to do to improve outcomes broadly for communities and for citizens across Derby. So, Chair, subject to any discussion or questions, would ask the the Health and Wellbeing Board to agree recommendations 2.1 and 2.2.
Thank you, Andy. Any questions for Andy in relation to this report? Alison?
Chair, not a question as such, but perhaps a proposal just in terms of one of the recommendations was to consider the role of the Health and Wellbeing Board in implementing the strategy. And I was just going to suggest taking some work out and just considering outside of the meeting in terms of what that might look like. And I know we're doing some work in relation to the Health and Wellbeing Board and the Integrated Care Partnership and looking at the relative roles within that. And just on that, there's just a reminder to the board that I think we had discussed, or it had been in a previous paper, that the LGA had offered to facilitate a joint session between both the Health and Wellbeing Boards and the Integrated Care Partnership that we're hoping to put in place kind of in the autumn, early winter. And that's, again, something we can look at as part of that group. And then my final point is we've obviously got the some work underway in terms of the development of the health and wellbeing strategy, which obviously also needs to take into account the integrated care strategy, and we can have a look as part of that process as well in terms of considering that recommendation, Chair.
Okay. Thank you, Alison. Yes. Okay, I think that's a fair suggestion. Lucy.
In the light both of those comments about ongoing work and also the previous discussion that we had, I think that there may be some opportunity to look at the value to be gained from the integration and awareness between the private voluntary sector and the public sector on this as well. And so make sure that we're making maximum use of the voluntary and private sectors to integrate. Because I think that is where, in the previous item, we might have been missing out. And I think this could be the same thing here.
Thank you. I think the voluntary sector are an integral part of this process already, as far as I understand it. I think, do you want to make any comments about private sector, Andy?
Well, certainly from the VCSE perspective, they're very much around the table. And this memorandum of cooperation or understanding, we considered at the Integrated Care Partnership only last week for the ICP. It was last week, wasn't it? And it was really positive to hear from the VCSE around, I think, both from their perspective, how seriously we're taking their contribution as representing a whole array of different organisations across Derby and Derbyshire. And they're very much clearly engaging with the communities and listening to communities in a way that we can't always do in the more statutory organisations, and using that collective insight to try and help understand people's experiences and what's happening across Derby and Derbyshire in an ICS perspective. And I think there was sign up an agreement to the ICS, to the Memorandum of Cooperation that came to the ICP last week. So I would see that the feedback and the reflections from this event that took place on the 26th of June, which we're currently working through at the moment, I think is going to be really helpful. And in terms of some of the kind of more practical points around the workshops that Alison W has cited, I think that's going to be really important opportunity for us to kind of get some of the key issues that have come out of the workshops as we start to try and progress this forward through the route maps that have been, or the roadmaps that have been identified. I think the private sector is an interesting point, and I think that, you know, certainly in some of the work we're doing in the kind of broader anchor space at the moment, so thinking about, you know, the role that the big public sector organisations have, like the council, like the NHS and its various constituent parts, as an anchor institution in Derby, and thinking about how, you know, we are rooted in our place, and how we need to think about how we work with our communities in developing pipelines into certain roles, how you look after our own workforce. I suppose what we try to do in Derby and Derbyshire, because we've got a kind of footprint-wide anchor approach, is to try and engage some of the private businesses across the city and the county, like Rolls-Royce, for example, the university, Chatsworth. We're having conversations about the role they play in that space, and, you know, trying to really kind of unlock some of those opportunities as well. So I think, you know, that, and that clearly has a read across to the Health and Wellbeing Board strategy as well, doesn't it, in terms of trying to tackle some of those wider determinants and trying to, you know, tackle some of the disadvantage and some of the challenges that we see in our communities as well. Hopefully that gives you a little bit an example, I suppose, of how we're trying to engage some of the private sector organisations.
Okay, thank you, Andy. Did you want to comment on this particular point as well, Chris? So it's another response to you, Lucy.
Yeah, just to support, and if I may, Chair, so what we're describing here is a very complex and complicated thing to do, which is to improve overall health and well-being. There are lots of different partnerships, lots of different organisations, and one of our roles over the next 6 months is mapping that out and making sure we're not duplicating effort and we're very targeted. So the work that Alison has described is, you know, absolutely crucial in terms of being clear what the role of the Health and Wellbeing Board is, the Integrated Care Partnership and the constituent agencies. In terms of the private sector, we've got another factor in Derby to think about, which is the Partnership Board, which is very, very helpful in my view forum, but there is some overlap that we need to work through, and Alison and colleagues are helping us think that through about the role of the Partnership Board, where private sector is around the table and is clearly engaged. So I'd probably suggest we need to do this mapping together and then bring it back for review and make sure we are hitting all the priorities with you know, combined effort. Thank you, Chair.
Thank you, and I think, Alison, you're very working on all this as well, aren't you? Thank you, Alison. Thank you. Carmel, did you want to make a comment?
I was just going to ask under point 9, the last point there was that there was no agreed decision-making process for the disinvestment and reinvestment, reprioritisation of existing resource. And I mean, I love much of what's there. I think the priorities, you know, start well, live well, age well, die well are great. But as I read it, I can see there's, you know, obviously some areas that we know are hugely underfunded and need more funding. So I wonder, I mean, I guess you're working on this, but I just wonder how you're going to sort out the decision-making process for that change of investment priorities.
Andy?
Well, I think, as you say, Carmel, I think that's something that we're still trying to work to at the moment. Answers on a postcard, have you any ideas? No. I think that that's going to be quite an important element, I think, of how we take forward some of the kind of more trickier, wicked issues. Need to be insight-led. I'm hoping, and I haven't got talked into detail with Alison, but I'm hoping some of the thinking and some of the kind of space that we're creating as we move into the autumn will provide an opportunity for us to look at some of these. I mean, some of these issues are not new, are they? You know, we always struggle, don't we, with what and how we're going to decommission and what that means. And, you know, we talk a lot about the significance of investing in prevention, earlier intervention, but it's really difficult, isn't it, because of some of the kind of statutory must-dos, the pressures that we've got from our own kind of, you know, regulators and so on. But I do think that, you know, there's an ambition, an appetite. You know, the practicalities of it, I think, are more challenging, but it's definitely on the work plan to think through.
Thank you, Carmel. I mean, I also highlighted that bullet point under 4.9, which refers to capacity gaps. And, you know, some of them are quite significant, aren't they, I think. Complex cross-system governance processes risk delaying the progress. And I think, you know, as a new person, relatively new to this role, and involved in many of these boards, I can immediately see that there's a lot of overlapping reporting and there's a lot of time taken up in attendance of different boards, etc., which is not all wrong, but I can see that there's an opportunity there to try and do something a bit more streamlined potentially. I just wondered whether on the first sub-bullet point in those bullet points, where it says enabling resource needs support to shift from focusing on organisational priorities to focusing on geographies and integration. Would it be inappropriate to say that that should also say outcomes there? I'm not being pedantic about the text. I mean, I think there's a whole point of emphasis there. Is that something that could be added to the discourse, if you like, Andy? Thank you. I mean, I think I would be tempted to ask some questions. I mean, I'll ask one question because I would like to ask more about some of these capacity gaps, because as Carmel said, the whole thing about the decision-making process is overarching and key. I think the thing should have a focus on outcomes, the complex governance processes we need to work on, and then this whole business of co-production, which I know is something we're very focused on in Derby. So I'm going to, for the sake of the meeting time, I am going to assume that other partners are also very focused on that. But I just wondered, so I'll leave that for now, unless anybody particularly wants to come in and make a comment on those bullet points. But I think also 4.10, this first bullet point says that we're to commit to and ensure prioritisation of prevention approaches across all service pathways, enabling adults plus children and their families who possess risk factors behaviours to access appropriate support services and or make suitable lifestyle changes. As we've got all the partners here, I mean, I'm not looking for an extensive thesis on any of this, obviously, but I just wondered if anybody had something to offer at this stage, whereby they have something to say from their organisation's point of view about how they might be prioritising prevention. Thank you. Chris.
Yeah, Chair, I mean, this is relatively novel to all of us in terms of receiving reports. So these are really valid questions, I think.
Right.
And we will have the opportunity in the Integrated Care Partnership to review them, and you'll be the co-chair of that. So I think there would be a really good opportunity in the Integrated Care Partnership to get into this. There's a partnership around that table. And so I genuinely think they are really important questions. I suppose the question that's going through my mind, and something we need to work through, is this is a report of the Integrated Care Partnership coming here, so the Health and Wellbeing Board knows what that partnership is up to, and can make sure that the Health and Wellbeing Board is doing something slightly different on the health and wellbeing agenda. So I suppose my question is, does the Health and Wellbeing Board recognise what the Integrated Care Partnership's going through? Is there any striking challenges in what the Integrated Care Partnership is on with from a Health and Wellbeing Board perspective? And then we can take that in the Integrated Care Partnership. I know it sounds very sort of bureaucratic in that sense, but this is a huge agenda, and there is a risk of having the conversation twice. So I think that's Andy. Is that a fair comment? I know it's not an easy thing to do, Chair, but so I'd be really interested that what does the Health and Wellbeing Board think of this, of the approach? Is there anything strikingly missing? And I think you're right to pull out prevention, but there are things we might then need to take into that partnership to work through. But I hope that's helpful. I know it's not easy ground at the moment. Thank you.
So you're saying you don't think it's appropriate or to articulate anything on prevention here at the moment?
Well, this is
your point. I mean, I appreciate what the purpose of the report is, and it's to note it. And I felt, though, that given we have all the partners here, that there might be some opportunity for people to say something. But if people don't want to do that, that's fine, and we can move on. Richard.
Yeah, Chair. I mean, I don't know whether you agree with this, Andy, but I would have thought one of the implications coming back here from that strategy is that there's more focus in the ICP strategy on tackling some of the root causes rather than focusing on the symptoms all the time. And I think that's really quite an important message that comes out to me in terms of coming back to this body, if I was being honest. Do you agree with that? And I think it adds to what you said, Chair, in terms of, and hear about how we prioritise and things like that. It's really hard sometimes to prioritise, isn't it, when you've got limited funds, but I think there's more of an emphasis stated in that ICP strategy about we really need to try and break this circle a bit and tackle some of the root causes, because if we just keep fighting the symptoms, we'll still be here 10 years from now. That would be one of the things I think would be important to come back to this as a health and wellbeing board.
Okay, thank you, Richard. Yeah, okay, well, we can discuss that at the ICP, but does anybody want to raise any further points in relation to this report? No? I mean, so it is put on as an agenda report, Chris. It's not a report just for noting. So, but does the meeting just want to note this report now then? Thank you. Okay, thank you. So the next item is you, Chris, as your update from the Integrated Care Board. Thank you.
Yeah, thank you, Chair. And it's, I mean, one of the fundamental questions as we go forward will be, there's been a historical agenda item around changes within the NHS, because the NHS has gone through relative statutory change recently. And so a question as we think through the agenda is, does the Health and Wellbeing Board want, in a continued way, or in a sort of single agency report? So the report in front of us is from the Integrated Care Board as the convener for the NHS family in Derby and Derbyshire. You know, so a question going through my mind that I'll pick up with colleagues outside the room is, do we still want a singular agency report coming to board? Question. As opposed to the NHS feeding into what I would think would be the Integrated Care Partnership report, but for debate later. The report, though, today does set out relevant changes within the NHS. With your permission, Chair, I'll come to 4.1 at the end because it's a duplicate item with item 9 around the joint forward plan, so I might be able to just kill two birds with one stone there. But really important items to pick out. It links to the conversation we've just had. It is a matter of public record that the NHS across Derby and Derbyshire has got an efficiency financial target of £136 million to save in this financial year, and colleagues will know that the vast majority of NHS funding goes on care and healthcare that's required at the moment, and we all understand the backlog challenges that the NHS has presently. Of course, we're working through that, and the ambition of the NHS is to deliver what is a balanced financial plan, but Section 4.2 describes how that will come about and where we are against it. There have been a couple of really important national announcements made since last Health and Wellbeing Board met, particularly around the long-term workforce plan that was published at the end of June, and we'll have all seen the media attention that received in terms of the number of training of new health and care professionals as part of that, and I've listed in the report the key messages that came out of the national document. Of course, locally, we are now looking at this as an NHS family about what does this mean for our 5-year and beyond plan, and working out with other sector partners such as universities and so on about the training needs that will be required to deliver that. Another important national document that came out again in May was around the General Practice Access Recovery Plan, which was very clear on the areas that Government and NHS England wished our general practices to work through, and as you can imagine, as a local NHS, we're working with our 113 general practices and 18 primary care networks about how we respond to that and deliver those very, very important ambitions that were set out. In terms of other matters for Board's attention, of course, annually the Integrated Care Board, like the predecessor clinical commissioning group, will go through an assessment process, and historically Health and Wellbeing Boards were an important contributor to that process, and I envisage that continuing. And of course the NHS locally has gone through quite a lot of leadership change recently, and you can see that today with Richard Wright being here as chair, having replaced John MacDonald, who stood down at the end of June. A couple of important care announcements. You've seen priorities coming out around mental health, learning disability and autism services, and also guidance around how the NHS can structurally partner with other agencies, particularly local authorities. I'll probably, if I can, because it's a really substantive item in its own right, just talk to the item 4.1, which is the joint forward plan. I'll very briefly mention this, Chair, because it's on for information only. But like the integrated care strategy that we've just published as an integrated care partnership, the NHS has published its 5-year forward plan at the end of June. The Health and Wellbeing Board, under the previous chairship, responded to that and contributed to that, its creation, and we'll be asking the Health and Wellbeing Board to further contribute when we refresh that in the autumn. But the plan itself will be refreshed annually. It is a 5-year plan. We're in year 1 already, but that refresh will happen. But hopefully colleagues will start to see an alignment between the NHS and other statutory partners' plans, the Integrated Care Partnership, and then the Health and Wellbeing strategy that, as Alison says, is currently being refreshed. So there's a couple of things really in terms of summing up, Chair. Obviously to note the report itself, note the changes that have been happening in the NHS locally, question around subsequent reports and any feedback on that I'd be grateful for. And then the specific for information item around the joint forward plan about recognising the refresh that will come through and seeking the Health and Wellbeing Board's views on that. And I'll stop there, Chair. There's a lot in that. Thank you.
Thank you, Chris. That's excellent and very succinct. I think we can allow some questions, though, on the content of the report, can't we? Before we do, though, I would like to congratulate the NHS on its 75th birthday. What a fantastic institution. It is struggling for all sorts of complex reasons, not least lack of funding and lack of direction from the top. But it is a fantastic organisation, created in 1948. It struggles on, and for all those who criticise it, they can't really manage to come up with a better system. So congratulations to the NHS and everybody who works in it, really, from this board. I would also like to congratulate Richard. I've met with Richard and had really nice conversations, so well done to him, and also to the other people who've taken on senior roles recently, including Mark Powell, Dean Howes and Paul Lumsden. These are really demanding jobs. Everybody recognises that. So thank you very much for the work you do. Do we have any questions? I've got a few more points, but before I'll shut up and let other people come in on the content of the report if you wish to. Any comments, questions? Okay, well, I would like to ask about 4.11, the NHS at 75, the work that's been done around that in terms of shaping the future in the NHS, and a survey that's been done of partners and users. I'm wondering if that's, I don't know where that's at with that and how that's being done, but I wonder if that's something we could look at here, some of the responses from that.
Certainly, Chair, happy to. So, I mean, the NHS at 75 is and was an important milestone for the service, but the conversation carries on. So, absolutely, to mark the occasion, we instigated, as a local NHS, multi-stakeholder conversations and about the current position of the NHS and future aspirations. But it is genuinely meant to be a start of a future conversation or the end of one. So you're absolutely right. We can certainly share the key themes that came out of that. But it is an important point for us all to reflect on. they're all of the NHS in partnership. So the conversation we're having here today around the NHS versus health in a broader context, the NHS's role in health and wellbeing boards, the NHS's role in the integrated care partnership, I think is a really important time, and all colleagues are clear in their view of our need to work more on prevention, go further upstream. That's something I think we're all agreed on, but as Andy says, how you change it when we're equally challenged on the here and now and the care needs of the moment is something we're all grappling with from whatever sector we work in. So yeah, very, very happy to, and it'll probably shape some of our conversation, that Chair. Thank you.
Thank you. Carmel.
Thank you. Actually, could I flip back to 4.3 in the NHS work plan? Sitting here as somebody who's seen umpteen changes within the NHS in all the time I've worked in it since 1975. But what I'm wondering about, I mean, I read this and I think, yeah. Improve the NHS permanent workforce over 15 years. And I know full well that the huge issue is workforce. So what I'm wondering, if anybody knows the answer to, is what's retention like in our current NHS workforce? And I suppose something particularly, maybe of secondary care, but right across the board really. You know, of those people who are trained, of the nurses who train locally, and the medics and the allied health professionals, do we retain many of those we train, or do we lose a lot? Because we know nationally there's a huge loss of trained healthcare professionals going off to Australia and New Zealand, where they're paid better and appreciated better these days.
Thank you, Carmel. Well, we do appreciate them here, but who wants to respond to that, Chris?
Yeah, I mean, happy to, and other colleagues will have a view, and there'll be a parallel view in other sectors, won't there, around it. So, and I know from our conversations, I'm not harping back around the different partnerships, but in the integrated care partnership, we want to have an active conversation around not just the NHS's workforce plan, but the health and care system's workforce plan, and how we want to work, as Andy said, in the anchor space on skills and the sort of the whole upstream work with universities around workforce generation. So there's a big conversation we want to have. The item here is clearly about the NHS's long-term workforce plan. There are 4 from memory and key components of the workforce plan. Recruitment is one, you're absolutely right. So the numbers we've set out around recruitment, retention is another. And you are absolutely right to set out that retention is a real challenge. We know that there are challenges in the morale across all workforces at the moment, but we know very publicly around the industrial action and the morale challenges that we have in the workforce. So retention is a key issue. It will vary related to specialty, and it does, and some sectors are more challenged than others, but it's certainly something we're focused on, very focused on in terms of general practice as well, not just our trusts and our specialisms. So you're absolutely right to say it. I mean, it would be helpful if we could have that conversation in the right forum to compare and contrast and then set out how we do this locally. But thank you. I'll hand over to Margaret. Thank you.
Margaret.
Thank you. Well, in support of what Chris was just saying, so below the board of the Integrated Care Board, we have subcommittees, and I chair the People and Culture subcommittee. And we've just, a year on, had a refresh of what our priorities are. And we call it workforce supply, but it includes recruitment, development, and retention. And you're exactly right, retention is a major issue, because otherwise it's like a bath, isn't it, with the taps running and the plug unplugged. So that will be our focus, and the People and Culture Committee comprises local authority staff and NHS staff and representatives of the voluntary sector. And you'll be very, very welcome if you were interested in following this further to join us or guest in at one of our meetings.
Thank you very much.
Oh, excellent. Well, I hope you're going to take that up, Carmel, and you can feed back to us as well, because it is the crucial issue, and obviously it's something I know the council has issues with, is recruitment and retention, and I think it's a bit of a missed opportunity, really. The government didn't also announce a workforce plan for social care, given that there's integrated initiatives in other areas. So obviously that's something to lobby for, because that's also very important. But thank you for that. Alison, did you want to come in?
Yeah, thank you. Sorry to take us back to kind of your earlier point, Chris, that I think you made a good point around the item around the Joined Up Care Derbyshire update. It was added as a standing item some time ago, as you say, was at a point when there were lots of changes, and we've obviously got an established route now. So it's perhaps that we don't need it as a standing item, but perhaps more bringing items of relevance and appropriateness from the system itself and individual organisations or NHS more broadly. So it's perhaps just as thinking about how we do it, because it was never intended, I think, as a single organisation update, and we have had things like provider collaborative updates, but it is probably, we don't perhaps need it as a standing item now, but that's something we could perhaps think about for kind of future meetings, Chair.
Okay, thank you, Alison. I've just done another couple of points, if that's okay. Does anybody else want to come at this stage? Just on the savings or the cuts, whichever way you want to call them, it's 136.1 million, which I know is a lot of money, but I also know that you've got a budget of 3 billion. So it's, you know, it is a lot of money. But I just wondered if you could just comment on that table. Chris, do you want to do that? Just about a sort of general comment about how those aims are going to actually claw that money back from the debt, I imagine, is it, that the ICB has. Thank you.
Yeah, I'm happy to and talk it through. And I mean, the position, if I can describe it, there will be a similarity with all public sector agencies around the demand for services, the costs of delivering those, and the budget that's available. And if we did nothing, we would be overspent by 136 million. So it's about the efficiencies we make in terms of service delivery that will then help us stay on balance. So the table in Table 1 shows for the statutory NHS organisations the financial positions that they have, the savings plan they have, and where we are year to date against them. We need to just also understand that the NHS family is a very, very broad one and has non-statutory NHS partners. So general practice isn't here because it's a set of organisations that delivers NHS services, but isn't a statutory organisation. So the actual financial position of the NHS is more complex than is being set out here, but this is a really good frame for the position of it. What it sets out and the approach is really this year about setting out where the money is spent, principally. And of course, colleagues know that our money is spent principally on health services, and therefore you'll see a real contribution from the service providers in terms of their efficiencies. You'll see the targets that are set for them and where we are against them. A couple of obvious challenges that we're working through at the moment, which is the effects of excess inflation that we're working through, that were above the original planning position. And of course, we're working through sustained periods of industrial action, and of course, that will have an impact on our position. Broadly speaking, those things aside, we are on plan for our financial savings. You are right to say that it is a huge amount of money in terms of efficiency, but the NHS spend is very large. You are right to say that. So the turnover of the NHS in Derby and Derbyshire is 3 billion, there or thereabouts. So it is a huge amount, but let's not understate the size of that saving based on some of the size of our organisation. So I hope that's helpful, and I know we talk about this in lots of different forums as well. Thank you.
Okay, thank you. Are there any other comments on this report? No? I'd just like to say, finally then, that I'm really pleased to read about the NHS expanding its soups and shakes service for people with type 2 diabetes. So we are mindful of time, so I won't talk about that anymore, other than to say I really welcome that. Have a real focus on obesity here in Derby, and childhood obesity especially. So I think any initiative that's proven as well to help people with that condition, well, it's diabetes, but connected no doubt largely with often with obesity, is really welcome, and that's, I think, the kind of thing that probably Richard and I would agree that you have to see more and more of, I think. So that's really excellent, thank you. So we can all agree to note that report then. Yes, thank you. Okay, so now we have an update on the Better Care Fund from Pervez Sadiq and Gumail Nizar.
Thank you, Chair. This is item 7 in your papers, and whilst we're in recognition of new roles moved, thank you and congratulations to you on your appointment as Chair of Health and Wellbeing Board. I'm sure colleagues will join me in wishing you well in your future stewardship of the board, which is a very significant structure within the overall system. So I'd just like to say that. On the Better Care Fund, this is a well-established fund in the city, in every locality, in every health system actually, and it is something that we have worked on together as a health and care system for a number of years, and it provides a pooled fund of a substantial nature to be spent on initiatives, and the primary objectives of those initiatives are twofold, and they are to enable people to stay well and safe and independent and at home for as long as possible, and for people to be provided with the right care in the right place at the right time. They are the overarching objectives of the Better Care Fund, and it demands that the local NHS and local authority and other partners work together to deliver those objectives. The contributions to the Better Care Fund are made up of a number of components as detailed at item 7.1 in your report. The minimum NHS contribution of 21.8 million, the Improved Better Care Fund, which is a direct grant to councils of 12 million, a disabled facilities grant of 2.3 million, and new discharge funding that is allocated to both the local NHS and the local authority, amounting to some 2.9 million. And that makes up the overall £39 million of the Better Care Fund. The metrics associated with the Better Care Fund are also detailed at Appendix 1, page 6, and they focus around avoidable hospital admissions, falls, discharge to the normal place of residence, a minimisation of residential admissions, and re-ablement. And those metrics are used to determine the performance of the Better Care Fund. The Better Care Fund is governed by a subgroup of the Health and Wellbeing Board, which is the Better Care Fund subgroup. The Better Care Fund goes through a national assurance process and it is in going through that process at the moment, and we will receive sign-off from the national insurance process at some point down the line, which will approve or make comment on our spending plans moving forward. All the initiatives that we intend to spend the Better Care Fund on are outlined in Appendix 1, and the recommendation to the board at 2.1 today is to approve the spend and performance objectives that are outlined in the report, Chair. Thank you.
Thank you, Pervez. I mean, this is really clearly extremely important work, and there's quite a detailed appendix there with all the work and the costings and responsibilities laid out. Does anybody have any questions or comment on this report? Lucy.
It's about communications and information, I think, and I don't know whether there is scope within this to look at that side of things. I've had a number of people who've commented on often trying to support an elderly relative and feeling a bit not knowing where to go to from the point of view of getting a handrail or what help should there be for bathing or showering. And help is out there, but people aren't necessarily aware of where to get it from. So it's an information gap between those who are trying to help in the first instance. And it's really good that we have people in the community who are trying to provide that help rather than going to a public sector and further burdening it. But it's the frustration of not knowing who to go to. And I don't know how to expand that. It might be something as simple as posters in GP surgeries or something like that. But I feel there is a gap in that knowledge. And if we were able to fill it, then it might make it easier for people to move forward. Is that something that there is a potential bit of a budget for within this, or do we need to look at that elsewhere?
Thank you.
So, Chair, I think it's a valid point that Councillor Kerr has raised. I think getting information and understanding out to people about where they can go is always a challenge. We've got a city of 260,000 people, and perfect information is difficult to establish. I think we have worked with GP surgeries about information. We've got local area coordinators who are funded through the scheme. There's one in every ward of the city who do hold information about where to go and can support and assist people. So that we have got a number of initiatives where we're trying to fill that space. I know it's not perfect, Lucy, and it never will be. However, we have got a statutory duty to provide information and advice to people, and we try to discharge that responsibility, both our health colleagues and ourselves, through a number of vehicles and touch points. And I think people do get frustrated at times that they can't find the information, but there's information on our websites, there's information that's available at your GP surgery, there's information available in the libraries. We try to do as much as we can, but recognising that it's an imperfect situation.
Thank you, Perez. Just before I bring Chris in, Lucy, I agree with you totally as a local councillor, and I think I haven't really discussed this in incredible detail with Perez and Andy, but I think that there are people who always need human contact when they need help, and many elderly people do. But I think this is one area where, if we're looking at the people, maybe there's people's relatives or people who are reasonably articulate. I mean, they'll often look on a website anyway as a sort of first starting point when you tap it into Google. And I think this is an area where I would hope that we could, I know we've got quite a good website already, haven't we, Pervez, looking at, but it's where we could perhaps expand this and bring all these questions together and actually use AI for this kind of information. to assist, like in a website, an interactive website using AI to try and bring all that together. For those who are articulate, I do stress, you know, the others do need just somebody to tell them. But so I'm hopeful that that's perhaps an avenue to look at to actually enhance the information services we already have, rather than replacing anything. Thank you. And so it's Chris and then Paul.
Thank you, Chair, and thanks for the question. So, so the Better Care Fund, and I'll pick up Councillor Kerr's comment as well. The Better Care Fund is the major pool budget between the NHS and local authorities, and mirrors priorities that we set in partnership. And this will be I think, and I might, you know, colleagues can challenge, but I think this will be the vehicle through which the integrated care strategy is delivered. And when we continually review this, we continually review the priorities of the schemes, and that focus will be there about creating the integrated care strategy. I think it's a really important question around, it's not just about the services we create, it's about the communication about them, because it's something I hear frequently too about. It's a very complex landscape, it's a very complex care landscape that we've got, and it is. So in any given day, there will be hundreds of thousands of interactions happening across health and care in this county, you know, and surrounding areas. It is complex. And so it's a fair challenge that when we review the Better Care Fund into next year, that we think collectively, are we putting enough around communication in there? I think it's a fair question, because we put a lot of effort into the services, don't we? But I think it's a really important question. Thank you.
Thank you, Chris, and I totally agree. So it's definitely something we could take forward, Lucy, and discuss in here and elsewhere. So I'm going to bring Paul in, and then it's Rachel.
Yeah, I think there's some simple solutions in this, and it was something we had a meeting this morning when I was with Rachel, that I think often the voluntary sector and faith sector engage with people a lot and don't have information to share with people. And I think sometimes it's not where we have the information, it's about where people point them to. So I think sometimes it's good to have a little crib sheet that just says, if you need this information, this is where you access it, and make sure that our communities and faith sectors have it so that we can pass that information on, because we don't want to spend fortunes on replicating the wheel, but it's just the best way of getting messages out to people is other people. And I think a crib sheet would make a big difference, and it's not really hard to do.
Thank you, Paul. Rachel.
Yeah, thank you, Chair. And my comment was really about, I mean, clearly the money, or any of the money, is not enough money to do what we want to do, is it? And we all know that, but how we organise the priorities, and particularly using the Better Care Fund in the best way we can as a system between us to get the best outcomes. I just was mindful that we had debates here previously about some of the impact of housing conditions, you know, for prevention and support, you know, the poverty of some of our housing conditions, some of the issues around the housing market that are happening here and also at a national level, and the implications of that when it was health. And that's a really important element of prevention, I think. And just to reflect for board information, we now have over 200 people in temporary accommodation in the city. We have 120 families in bed and breakfast in the city, and those are staying there for over 6 weeks before they then go into temporary accommodation for potentially a year. The pressure on the market is getting worse all the time, and I just wonder whether I was surprised to see nothing in here over and above previous use of the money for things like the handy person scheme and falls to really tackle some of those issues. I know we discussed that previously, and whether the next review of the Better Care Fund could take into account some of those initiatives that might be able to prevent some of those issues from the housing side.
Thank you, Rachel. Do you want to come back on that, Pervez?
Yeah, certainly. You know, we're always open to suggestions about what we want to spend our money on. We obviously want the greatest return on what we're spending our money on, and we have to prioritise because, as you said at the outset, Rachel, we know there's not enough money to do everything that we want to do, but that which has an evidence base that's going to give us the greatest return overall on what we're trying to achieve, that surely merits the greatest investment. So happy to consider that in the review, as Chris has articulated, when we have a look at what it is that we're investing in.
Thank you, Pervez. So you're committing to looking at that then? Yes, thank you.
Just to help Pervez, colleagues around the table won't necessarily know, but the Better Care Fund is heavily prescribed about what is allowable in there. So within the bounds of what is set out by the Department of Health and Social Care, yes. So I think we need to be careful on the commitment, definite commitment to review, because we are going to review, it's part of our annual process. I think as the integrated care strategy gets more clear, as the Health and Wellbeing Board strategy is refreshed, I think that it will become more obvious as to what our joint priorities are, but it has to be caveated about the prescription that comes from government around what goes in. So I think Pervez is right within that caveat. Thank you.
Thank you. Gina?
It's on that theme, I think there's general consensus that the BCF is a good vehicle for partners to come together and focus on the biggest interventions that make a difference with the goals of the BCF in mind. And of course, the paper reminds us that it aligns well to the kind of age well, die well goal within our strategy. But clearly there's opportunity here to adopt the same principles that the BCF embodies across our wider service portfolio. And I know in our joint forward plan, there's a commitment to looking at financial models that encourage the right behaviours. And I certainly would endorse this sort of approach to a broader range of services, thinking about early intervention services that would benefit from such an arrangement. So despite the parameters and prescriptive nature of BCF in its format, I think there are things that we can take in principle terms to apply across a broader range of services that I'm sure would have similar value.
Thank you. I'm going to let Lucy come in, and then Pervez, if you want to respond.
Hi, it was just on the communications side again. So there is a tool that's been started to be developed within Joined Up Care Derbyshire, and it's on their Exchange Teams channel at the moment, and it's been worked up by somebody called Victoria Biggin and Ben Milton. When I've just had a quick look on there, there is some links in there in terms of equipment and where to access and things like that, but there's not so much the Derby City stuff. There's a lot of stuff that's Derbyshire County Council, so it might be something that we could link that together to join that up. I'm not sure where that's planning to go as a network, but again, it's just another point of contact where we can keep up to date.
Yeah, thank you for that proposal. It's helpful to have suggestions and not keep reinventing the wheel. Sure, thank you.
So I don't think there's anything for me to come back on in earnest. Okay, just to accept everybody's views and recommendations and say we're listening and we're happy to have a discussion on any of the issues that have been raised.
Excellent, thank you. So, are we all happy to accept the recommendation as noted at 2.1? Yes, thank you very much. Is Sue Cowley-Shaw from the Health Watch. She's got two publications, one on the Patient Advice and Liaison Service, the PALS service, experiences, and that's just a mini report, and one on the another on the medicine order line experiences from last year. Sue, thank you.
Thank you. Just want to say these are two fairly short, succinct reports, so they won't take too long, hopefully. They are of necessity short in comparison to what we may have brought here previously, because at the time that these were undertaken, we were understaffed, but I'm happy to report we're now back up to full strength and undertaking two much meatier projects as we speak. The Health Watch Derby PALS experiences mini report was really to provide an overview of what was happening with PALS services for people within the Derby area. And the impetus was that Health Watch Derby had received a number of enquiries from people who were having some difficulties in trying to access PALS. So it's not particularly about what PALS was offering them, it was more about the access issues. Bizarrely, when we crunched the figures, and there were only 20 respondents for this survey, which perhaps says something about the level of usage that PALS receives, and maybe there's another piece of work there about their profile. Around half said they found it difficult or very difficult to contact PALS, and another around half said they found it easy to contact PALS. So there's a bit of a dichotomy there with the report. The reasons people had contacted PALS, 56% had called to raise a complaint about a service provider. 28% had called for advice about a bad experience. And the way in which they contacted PALS were 50% had used the phone when they could get through, and 33% had used email. The negative comments were primarily about the amount of time it took to access or get a response from PALS. 50% of the samples said they'd been listened to or the issue had been resolved. We're saying because of the size of this sample that further research is probably recommended and try and get a larger number of people. This report has been shared back with the PALS service, and it appears that some of the problems related to a new automated phone system which had been put in, and PALS themselves were short-staffed at that time. Apparently, the situation regarding telephone contact has now been resolved and no further issues have been reported, and staffing levels have increased to support increased contacts. So this was a short survey carried on throughout January this year, which was promoted through online media. And we just really ask the Health and Wellbeing Board to consider and note the contents of this report.
Thank you, Sue. Does anybody have any comment for Sue's report? Chris?
I mean, just to set out, I mean, thank you. The scale of patient liaison services across the NHS is enormous. So we have PALS services in all of the major services, including the Integrated Care Board, and I can only attest to what I see from the contacts with the Integrated Care Board. They are significant. And so I think we just need to be minded to volume and scale. But I think the comments are always helpful. And thank you. But an enormous part of our sort of engagement and interface with service users. So thank you.
Yeah, I think Sue, and the report acknowledges that it was a small survey and that you probably intend to do further work.
I think some further work is required, really, yeah, just to get under some of the issues and see if we can tease out anything more meaningful that we can.
Because you presumably initiated this inquiry because you had many complaints coming to you.
Yeah, that was right. Yeah, yeah.
Thank you. Yeah, I mean, the point I would just observe is just how it's very consistent that when people are in need, there's a certain category of people, at least, that have just they just want to talk to someone. It's the first aspect of reassurance and help is actually getting through to someone that they can actually talk to, and I think the report makes that clear, doesn't it? Any other comments on this report? No? Well, I'd like to thank Sue for bringing that one here, and thank you for keeping an eye on what's happening from Health Watch, and also, you know, taking seriously people's concerns that they raise with you. So do you want to talk about the other report on the online medicine ordering?
Yeah, happily. The second one was the medicines order line experiences of patients, really. And I'm sure we're all aware that the medicines order line is in existence. It's been there since 2017, which I don't know, I didn't know about it until relatively recently myself, so it seems to have taken a while to build its own profile, I think. What we wanted to do, really, was to try and find out how we could help the medicines order line improve the way they run the service. Overall, all the results were positive. The majority of people who'd used the service saying they'd recommend the service to others. There were positive comments about the staff being helpful and friendly. The speed of service was also commended. Areas for improvement were the length of time it takes to get through to the service on the phone, the need for increased staffing levels, general communications and accessibility, particularly for the hard of hearing. This survey ran between December of last year and January this year and received a total of 87 responses. Given that the medicines order line is primarily a telephone ordering system for repeat prescriptions, we didn't do this as an online survey particularly, although you could answer online. we decided to carry on by focusing on planning community events to ensure we spoke to people face to face to find out what their response was over the use of the service. So we've shared with the Medicines Order line and tried to raise their awareness of some of those issues, and we wait to see what their recommendations are going to be.
Thank you, Sue. So there were a couple of issues, but overall the response was very positive. Yes, thank you. Anybody want to comment on that, Chris?
Yeah, sorry, and thank you, and apologies for having to leave the meeting early, but which I will do in a second. But thank you for the report. Really appreciate the insights. Just to remind colleagues, this is a really important initiative that's been built over many years now, and links to the item earlier around efficiency and financial efficiency, and is a real success story for reducing the waste of medicines. And now, from memory, I may have got the statistic wrong, but covers well over 80% of the Derby and Derbyshire population now in terms of its rollout across our general practices. And so has been a really strong initiative. I really welcome the positive feedback again. This reaches thousands of people. So it's really good to see that. Obviously, this is a service the Integrated Care Board runs on behalf of our practices, and so I personally see any complaints or otherwise that come through, and I think the report is commensurate with my view of the service too. So thank you.
Thank you, Lucy.
Yeah, it was just it just made my head go from the previous conversations we'd had about AI and things like that in the NHS app, and actually how does that link together with this ordering line, in the fact that there might be further opportunities for efficiencies if we're using artificial intelligence to help with the ordering, or using the, I know that a lot of people, I personally use the NHS app to order my repeat prescriptions, so it's how do we join those things up to make it an even more efficient service, especially if they're saying that the telephone the waits for getting through are longer.
Thank you. Margaret, did you respond to that?
I use the NHS app too, but as a carer for an elderly relative, not a chance. The care line, the order line, has been absolutely brilliant. It's a godsend, because many of the surgeries are now no longer doing the repeat prescriptions. You know, I used to put your prescription in a box and say what you wanted. A lot of them haven't got the time to do that. So this telephone line makes all the difference. It doesn't in any way remove the need or value of the NHS app for those of us who've just got a smartphone and just click on. That's brilliant too. But for me, this is about people who really need somebody to talk to, and my experience of the service, as well as obviously I'm a provider of the service, but the experience of it has been fantastic. Totally agree about the waiting, telephone answering. I just wonder where you don't wait nowadays for a telephone answering. It's almost ubiquitous, isn't it? If you ring somebody, you have to wait. But I think it's very, very complimentary. And also, they're actually very careful about people who are hard of hearing. And they will often say, is there somebody who can help you, you know? So I think they're complementary. And if we hand everything over to AI and apps, I think we'll be disenfranchising a portion of the population who really need this sort of help.
Thank you, Margaret. Carl?
I would just want to say that I'm sure it's the same in all practices across Derbyshire and the country as where I worked. Patients are given a choice. They're told they can use the telephone ordering line or they can order online, and given information on how to use the different ones. If I could just add a comment, I think the main reason... Sorry,
Carl, can you face the mic,
Sorry,
please?
beg your pardon. I think the... Yeah.
Thanks.
I think the main reason for getting rid of little boxes with bits of paper for requesting your prescription was security of the requesting of the prescription. It wasn't a time, because I don't think it actually reduces the amount of time that practices spend, which is enormous, in dealing with repeat prescriptions. It was to make it more, improve confidentiality and improve accuracy.
Oh, okay. Thanks for that clarification. Yes. Okay. So I guess it's Chris who needs to receive those, or are you receiving those comments, Margaret, on behalf of Chris? Thank you. So I think there's some interesting thought there to take away. I think this is a service that I've used, and I found it extremely easy and very efficient, actually. So, Sue.
Can I just say that we are planning to do a follow-up at the end of the year for the Medicines Order line to see if any improvements have taken place?
Well, thank you, Sue. So I think it would be, so if we can all agree just to note this report, are we all happy to do that? And then, Sue, if you want to come back at the end of the year with a follow-up, and also, obviously, they need to formally respond. So, but it's good to note that there's largely positive, and it's good to see, you know, where there is positivity, we should recognise that and acknowledge good developments. So thank you, Sue, for that. And then, so finally, we come to our very final item, I think, which is the update on the Derbyshire Health Protection Board, which is just an item to note from Alison.
Thank you, Chair, and exactly that. It is just for the information of the board, so it just gives kind of very brief highlights of the last Health and Wellbeing Board, so I won't take you through that, but if there are any questions or queries that anybody has, I'm happy to take those away to either Robin or the Health Protection Board itself. Thank you.
Thank you. Are we all happy to note that report? Okay, so when's the date of the next meeting, Alison?
It is the 7th of September.
All right, well, thank you all for coming. Richard, you want to come in there? Just as we're
Just
about
one
to
last
close,
thing.
go on then.
No, one real last thing. It's just about statutory members. Can I just replace me with Margaret as the statutory member? We've done some division within the ICB, and I thought it's just worth noting it before the end of the meeting. So
thank you, Richard.
I'll still probably come along at times, but it's just to make sure you've got one point of contact.
Thank you.
Thank you.
Okay, yes, that's fine. Thank you very much, Richard and Margaret. Okay, so have a nice August, and we'll see you in September. Thanks very much.